Hi, Dr. Hatem. Thank you
Hi.
so much for taking the time to speak to me today. It's a real pleasure. To get started, if you can please just introduce yourself and tell us a bit about your background.
Okay. Thank you very much for this invitation, Mustara. My name is Hatem Abbass Ghonim. I'm a consultant radiologist. I'm the medical director of Unison Capital Investment.
So, yes, in terms of Unison, you mentioned you're the medical director for it. Is that correct? So,
Yep.
in terms of the role that you have, can you tell us a bit about it and what you oversee, what type of role you have at Unison?
Well, actually, my role although my background is as a radiologist, but still I have to maintain and supervise the service delivering, starting from the reporting of the cases, be sure that the quality of the report is okay, and we'll go on this in depth more maybe in the few minutes, and then the technologist, the level of the technologist, how to do the procedure, especially when we are talking about CT or X-ray, when there's radiation hazards, and to assure that the patient getting the best service with the lowest possible radiation. Regarding the patient, when he steps in, to be sure that the patient has not exceeded the waiting time for him, and also to ensure that once the referring physician place an order for an imaging, till he received this report on the system, it runs smoothly within what's called the key performance indicator, the KPIs.
Great, that's great. So you've set that all up in terms of the KPIs for Unison to be able to achieve it, which is great to see that you're overseeing all of these different roles. Now, my next question, as you know, the pandemic really had a major impact on the healthcare sector overall. So just wanted to understand your thoughts on how things have changed for your business, over the last few years. And maybe if you can touch upon has the patient experience, how it's evolved since the pandemic has changed.
Yes, actually, during the pandemic, we have obligatory change of our vision for how to improve the service, and it makes us we faced a lot of issues in the beginning and some challenges, but due to the non-availability of maybe the service in part of the hospitals or centers, the precautions you have to take. But again, the presence of the imaging online, for example, you can report the cases remotely, and even when we have to stay at home, the patient do the examination, and then we can report the cases remotely. And this actually this changed our behavior even after the pandemic. Nowadays, to be honest, it makes life in the beginning very tough, but now it's much easier.
That's great. Yes, I think there are a lot of key lessons learned that happened during the pandemic. And I think, for Unison also, you would have uncovered a lot of different things that you wouldn't have possibly seen beforehand, right? So it's nice to see that, you had key learnings from everything that happened during the pandemic. So one other thing, we're seeing now an uptake of artificial intelligence solutions in healthcare. Just wanted to kind of understand, what is your point of view on the use of artificial intelligence in the healthcare setting, and how can it really help in a healthcare setting?
Well, actually, to be honest, in the beginning, we thought, and I remember in the RSNA in 2006, when I attended this, and they said artificial intelligence is going to replace many of jobs, particularly the radiologist. But in my vision, after experience with the artificial intelligence, I found it is a big support. And I remember one of the statements said by one of my professors that he said, 4 eyes is better than 2 eyes. So definitely this improves the service, because you have another opinion immediate within seconds you can see the opinion of the system, and this system based on the machine learning, the more that data by time, the more accurate or near accurate the diagnosis. So I believe still there will be a role of radiologists. It's not going to replace the radiologist, but artificial intelligence plays very important role now. We are applying it in our in Unison in mammography, as in in mammography there are 2 blind readers, so we introduce the AI to be the first reader, and then a second reader, and then a third blind readers, and then if there is a debate, still there is a consensus reader. The first line, I believe till now, the artificial intelligence plays the role as a first line of diagnosis, or at least give an impression about that case. Now, second is the role of artificial intelligence in mass radiography. For example, in chest X-ray for visa screening, we can see maybe more than 1 million studies and applicants are should be reviewed in 1 year. So we are talking about a huge number, and once you apply the artificial intelligence, it helps you to confident diagnosis if there is an opportunity to have this artificial intelligence, and something you can be confident in your diagnosis when there is an abnormality, or if there's normal chest X-ray. And the nice thing that you give also sort of flagging for the cases. So chest X-ray can be normal, green flag, and then red flag means tuberculous, because visa screening is concerned about the infectious disease, mainly tuberculosis. And then it can be yellow in case of COVID-19. It can be blue in case of any abnormality other than TB or COVID-19. This helps us a lot in the beginning. We faced some issues in the beginning because of the in the start, but with time and with the machine learning and the software upgrade and improvement, we have I believe that it was amazing experience that we see the improvement, and for the machine to give an impression, which I believe now we are reaching false negative, maybe less than 1% of the cases, which is a big achievement. Again, the artificial intelligence is used also in, I believe the most important, or the focus should be within the emergency department. Why the emergency department? Usually the patient comes with fracture, with a stroke, and the first one who is going to see it is the emergency doctor. He doesn't have time to wait until the report comes, patient sitting in front of him. Is there a fracture or no fracture? Sometimes fractures are minor and hairline, and the referring physician can easily miss it. And in this case, he will send the patient home, and then the patient will come back with complaining. So again, artificial intelligence play a very important role in this, in the stroke, early stroke, where you have the gold standard 3 hours to diagnose whether to start with thrombolytic therapy or just this is an old infarct and you have to deal with it. So in the early beginning, the CT is sometimes it's very difficult to diagnose it, because you are not diagnosing the infarction, you are diagnosing based on the indirect signs of very early acute infarct. And this is one of the field, or one of the points, disease which artificial intelligence help. Also for screening for lung cancer. For example, we have screening now not only for the breast, for the lung. You can run this software to pick any early detection of cancer in the early stages, so that you can save time, save the life of the patient, and save also the cost of for treatment when it is discovered as an advanced one.
Yes. I think just the last final question I wanted to ask you, is there any advice that you would give to people in similar roles in terms of AI and the adoption of artificial intelligence?
I believe artificial intelligence now should be adopted in any radiology department. Mm-hmm. It's a helpful tool. And I remember in the old days, usually when sometimes you were put in front of a case and you need a second opinion, and you look for one of your friend who has knowledgeable for neuroradiology or musculoskeletal radiology to give you the opinion. So artificial intelligence is a help and immediate help. This is very important for us in the future. So I advise all the radiologists to apply for the artificial intelligence for any, because there is a wide range of application now, and it is it's there and it's available, and you can just with one click you can take the second opinion. So why not? It's not going to replace you, but it's going to help all the radiologists. Yes,
exactly. Thank you so much, Dr. Hatem, honestly.